Now, beyond national borders, Singapore was perhaps one of the first countries in Asia to declare a gradual shift in strategy against COVID-19 this past summer. While authorities there are still learning to live with COVID-19, and for more on those efforts, I have Professor Paul Tambaya at the National University of Singapore live on the line. Professor, thank you for being with us.
Hi, how are you?
Fine, thank you, Professor. I'll start off by asking you about this. There was a bit of a scare this last Wednesday, that is, when Singapore reported a jump of over 5,000 new infections. Now, have authorities, Professor Tambaya, shared with the public the reason for this sudden surge in daily infections?
Well, they haven't, and it's actually a small blip. We've been having consistently 3,000, 3,005 cases a day, but this actually represents a small proportion of the actual new cases, because the majority of healthy young people are doing the rapid antigen tests at home, and they're staying at home, quarantining themselves, and this is what essentially living with the virus is all about. If you're sick, you go and see a doctor. If you're well, you test yourself, you stay at home. Interestingly enough, we're using tests developed in Korea, and they work pretty well, I think.
Oh, I see. Professor Tambaya, Singapore's vaccination rate stands at above 80%, and the wearing of face masks, do correct me if I'm wrong, is mandatory there. How do you explain the resurgence in cases then?
Well, unfortunately, this resurgence in cases illustrates the limitations of non-pharmaceutical interventions, such as the mask mandates or social restrictions. But the vaccination rate, what it has done is it has kept the number of severe cases down. So even though we have several thousand new cases every day, we've got less than 24 new patients ending up in the intensive care unit. And we've had between 10 and 20 deaths from COVID-related complications every day. So again, that's what living with the virus is looking like for us. Large numbers of new cases, but mainly mild illnesses.
That is good to know, though. One essential aspect, Professor Tambaya, of learning to live with COVID-19, as you mentioned, is keeping track, of course, of the related death toll and cases of severe illnesses. How is Singapore once again then doing on that front?
Yeah, so we are keeping track of severe illnesses, deaths, intensive care utilization, just like I heard earlier that you are doing in Korea. And part of the reason is that, unfortunately, the current vaccines do not prevent transmission or infection as a whole, but they are highly effective at preventing severe illness. Now, people are still thinking about the daily case number because that's what they've been thinking about for the last year and a half. But slowly but surely, we're coming around to the idea that we're going to have large numbers of cases, but what really matters is that people are not dying from the disease or ending up in intensive care.
Right. Professor Tambaya, what's your take on efforts to further boost Singapore's public inoculation rate as part of efforts to better contain the resurgence there?
Yeah, so frankly, I don't think that boosting the vaccination rate is going to contain the resurgence. What it will do is it will reduce the number of severe illnesses and deaths. And our vaccination rate is pretty good. The 84% actually represents the whole population. So it includes children who are not eligible for vaccination. Amongst adults, our vaccination rate is way over 90%. So I think, while it's good to try and catch the last few individuals who haven't been vaccinated, I think we also want to be careful about alienating some of them through some of the policies.
Right, and talking about alienating some of the members of the public, Professor Tambaya, I understand that starting January, workplaces in Singapore will ban the entry of unvaccinated people. How is the public responding to this upcoming measure, and how are authorities preparing to address concerns that you mentioned over discrimination against those unvaccinated?
Well, the vast majority of people think that this is a good idea because they don't like the idea of people getting sick and ending up in the intensive care unit and straining the healthcare system. But we have a significant vocal minority of individuals who are very concerned for a variety of reasons, some good, some not so good, about the vaccines. And personally, I think that it's better to persuade them rather than to resort to punitive measures. The authorities have given some options, like, for example, if you genuinely have a medical exemption, you can be exempted from some of these vaccination requirements. Or if you just don't want to get vaccinated, then you have to do a PCR test within 24 hours of going into work or going into a public place where vaccination is required.
And finally, Professor Tambaya, what words of advice would you care to share with Korea as it begins its journey into a new normal starting on this Monday?
Well, I think, some of the things have gone right in Singapore, like, for example, rolling out widespread rapid antigen testing, doing away with quarantines. But some of them have been a little bit confusing with the social restrictions. I like the way you've got three phases. I think that's a good idea. So, you have to have certain cutoffs at which point you go ahead and press on, despite the rising number of mild cases. And so it's really important not to get hung up on the number of mild cases, but to focus on the strain on the healthcare system, to learn to identify cases early, make sure everyone is treated appropriately, and eventually we get back to normal.
All right, Professor Tambay, hopefully that will be the case. Thank you very much for your time and your thoughts.
Thank you.